Well, good evening, everybody. Again, my name is Charlene Margot, and I'm the founder of the Parent Education Series, a program of the nonprofit, the Parent Venture, of which I'm a co-founder. My partner, Bev Hartman, is here with me tonight monitoring the chat. So thank you, Bev. Tonight's presentation is Parent Café number 4, Mental Health and Community Resources for School Reopening. Obviously, this is a really important topic as the high schools begin to reopen. So we're very grateful to tonight's presenters. We have with us April Torres, who's the manager of mental health services for San Mateo Union High School District, Miriam Stevenson, who is the executive director of community engagement for Care Solace, and Tyler Chamness, who's the manager, client relations manager also for Care Solace. So a lot of information, a lot of resources for you tonight. We will be recording this event. So if you were unable to make it, or if you have a partner or a spouse or a child or a friend who would like to join, this will be available on our video library, free to everybody. So again, recording tonight. Just briefly again, our next event is actually tomorrow at 12 noon. We are doing an event with Dr. Anna Lemke from Stanford School of Medicine called the Neuroscience of Addiction. We hope you will join us for that. Going to be a great presentation. Dr. Lemke was recently featured in the documentary film, The Social Dilemma. So again, she'll be talking about the neuroscience of addiction. I want to thank our partners, the Peninsula Health Care District and the Parent Venture. The Parent Café is a new initiative of the Peninsula Health Care District. These are virtual parent discussion groups where we are open to all of you to bring you information, resources, things that are interesting and important to parents right now. And then we invite you to join us for questions. So tonight's format is we're going to open with about 20-25 minutes of content between April and Miriam and Tyler. And then we're going to open it up for questions. Tonight in the chat, we hope that you will put comments to one another. Again, my partner Bev will be putting links. And actually, during April's presentation, you will be seeing resource links pertinent to each of her slides. So please do check the chat. Then after that, feel free to talk to one another, talk to us, or put your questions in the chat box. We'll be ending with at least 15 minutes of Q&A time. All right, let me tell you a little bit. Oh, and at the end, you will see a link to a survey. We hope that you will take just a couple minutes to fill that in. We promise we read every one. It helps us in planning for future events and also to give information back to our funders. So thank you for that. All righty, a little bit about tonight's first keynote presenter, April Torres. April Torres, MFT, is the manager of mental health services with the San Mateo Union High School District. April has worked in education for the past 22 years, including 15 of them with San Mateo Union High School District. She is a strong advocate for student equity and mental health, and she uses her background in education, administration, and her license in marriage and family therapy to support these efforts. Please join me in welcoming April. April, why don't you start and tell me when you would like to have me share your slides?
Okay, great. Thank you. So we could start with the introductory slide. Thank you for sharing the screen for me. I appreciate that. So again, my name is April Torres. I'm excited to spend the next hour or so together. I am happy to see a lot of you, the participants here. I know a few. I saw also a teacher, Karen Fields. So hello, Karen. Nice to have you here. So our goal tonight is really to share mental health, school, and wellness resources. And as Charlene said, as we go through the slides, I will drop into the chat different links of resources so that you can peruse them at your leisure. And then we'll also have them available for you when we post this on the website. So the chat is, we have an intimate, smaller group right now. So please use the chat. I welcome you to share your ideas, what's worked for you, other resources that you have found to be helpful. you are all the experts in the room, in the Zoom room. So collectively, I think we have a lot of great information to share. And that's really what our parent cafes are about. It's sharing information amongst each other and discussing best practices to really build that strong community that supports our students. So I'm going to get started. Just a little bit about our program. The San Mateo Union High School District, we've had our program now this is our 5th year. We have about 30 therapists. They cover all 7 of our high schools, our middle college program, our bridge program, the 2 alternative programs. We also cover tobacco use prevention education program. And there will be a link that is put into the chat that gives you a little more information on our restorative justice programs for students. If you are interested or want more information or how to maybe sign up for yourself or for your student, please feel free to use that contact information from our website. So there's information on our vaping awareness, prevention, and education program, our substance use program. We have a brief intervention program, 2 alternative to suspension programs, our traditional and our cyberbullying and media awareness. And we also have a district-wide parent support group. And so if you are interested in any of those, please feel free to reach out to Laura or Jessamy. We also cover the Stanford Teen Mobile Health Van that we're on our 4th year. We've just been accepted for another grant through Peninsula Health Care District. So we're going to go ahead and continue that. And I'm sure there's other things we do that I just can't think of off the cusp. So with that, I'm going to go ahead and get started with our first slide. And talk to you about, I would say 3 or 4 kind of themes that we seem to work with students predominantly on. Parents seem to reach out to us a lot about, they ask questions. So I wanted to just share some information. In the chat, there's going to be a link to the Child Mind Institute, some information on parenting depressed teenagers. And Child Mind Institute is just a wealth of information, and they're located in San Mateo. So that is I would bookmark that web page because you're going to want to go back and look at it. There's information for parents, for educators. So please take some time, and they are welcome to they welcome phone calls, and happy to support with any information. So depression, what you do see and what you don't see, right? Sometimes we see things at home that look a little different than what the teachers see in the classroom. But I often get asked, well, what is depression, right? And it's that constant feeling of sadness and loss of interest, which, stops us from doing normal activities. There's different types of depression, everything from relatively minor to very severe depression. It's typically not the result of a single incident, but more of a mix of events and factors. And right now in the pandemic, and some students returning, some students not returning, there's a lot of factors that increase that risk. So there's factors that let's say issues with bullying, academic problems, having been victim or witness to violence such as physical or sexual abuse, self-esteem, weight gain, weight loss. So just a number of factors. Nearly 50% of those that are diagnosed with depression also suffer from an anxiety disorder. So we usually call them cousins. So depression and anxiety are in the same family. It's also the leading cause to disability in the United States. So amongst our young people from age 15 all the way to 44. And women are more likely than men to be diagnosed with depression. That doesn't mean they don't have depression. It just means women are typically the ones that seek support and diagnoses. So Child Mind Institute, there's some information on parenting depressed teens. Look through that. I'm going to move on to the next slide, which again, depression's cousin, anxiety. So we have the stress and the anxiety. So both are normal. And although they can sometimes be overwhelming to people, they are normal. In the chat, you will see a couple of different resources for why stress happens and how to manage it, stress and resiliency with the Child Mind Institute, and what to do and not to do when children are anxious. So what is the difference between stress and anxiety? So stress is a response to a specific stressor, and anxiety has no identifiable root. So that's predominantly the difference. And, you know, you've heard stress can also be positive, and that is true. So it keeps us alert, it keeps us motivated, it keeps us ready to avoid danger. So an example would be if you have an important test coming up, a stress response might be your body's working harder and you're staying awake longer. But stress can become a problem when stressors continue without relief for periods of time, right? So we have two types of stress. We have acute stress and we have chronic stress. So acute stress is short term. It's the most common form of stress. Examples would be if you've had a recent argument or you have an upcoming deadline, and once you have resolved that argument or you've met that deadline, your stress reduces or dissipates completely. Chronic stress, it develops over a long period of time, and it is more harmful, right? It occurs when people, you know, can see no way to avoid stressors and they just stop seeking solutions. And it has been linked to adverse childhood experiences. So symptoms of stress and anxiety, they can be normal. They can cross over to unhealthy. And what we want to do is be able to support and manage our stress. So in the link, there's some information on that. It'll include relaxation techniques. It could be simple meditation, some deep breathing, resting, yoga, exercising for the mind, replacing negative thoughts with positive thoughts. And that's a challenge, right? So, you know, kind of rising to that challenge, exercising our minds. Having a support network with our family and our friends. It could be your school or wellness counselors, any trusted adult. And then exercise, we know, really releases chemicals in the brain that trigger positive feelings. And it always feels good when we get out and exercise. A lot of our young people, I was just on another webinar for the Hillsdale Bring Change to Mind Club. And so the young people were talking, and some of them had said, you know, they roll out of bed and they don't leave the house for days or move much. So, you know, they all admitted that exercise is so important and it feels so much better. Also, counseling, possible medication, although that's a personal family decision. And I highly encourage talking to your pediatrician or psychiatrist to support any informed decision that you decide to make with that. Okay, so I'm going to move on to slide 4. I'm trying to move kind of fast because I really want to give time for Q&A and also for Care Solace. So what teens may be experiencing. I really like this slide, like really, really like it, because we look at the top part of this slide, and these are the behaviors. These are the behaviors that drive us crazy, right? They frustrate us, they frustrate parents, they frustrate teachers. They're just frustrating, right? The complaining, well, I'm going to say excessive complaining, because we know teens and tweens oftentimes can complain, but excessive, right? Excessive complaining, fighting, not following rules, being disrespectful, all of that are behaviors. But underneath that are reasons why, right? What's the meat of what's going on? And more times than not, there's something underlining of of those um, of those things that are just really frustrating us. So if we can take some time, take a breath, and remember that they have things going on that might be manifesting through these behaviors. They have fears, they have worries, they're confused. This is uncharted territory that we're in right now. So really just having some time to, for us to take time to remember that they're confused, they are bored. So talking to your teens about some of these underlining things. So starting early, it's never too early and it's never too late to start those conversations with your children. Modeling good communication. And I said this in a prior Parent Cafe, but I always come back to it, is when your child wants to talk to you, sometimes as parents, we're like, oh, this is great. They want to talk to us. What do we need to do? And there's a lot of times that they don't need us to do anything but listen, right? So less talk and more listening. And I often will ask my own teens, do you want me just to listen? Can I ask questions? Do you maybe want some advice at the end? It takes the pressure off of me to know what they need from me. And it also helps them not feel frustrated when I'm not supporting what they need. So modeling that good communication is important. Compromise. Every relationship is a series of compromises. We always want things our way because our way is the right way, right? But every relationship is a series of compromises. And trying to stay positive during these conversations. I know that they bring, a lot of times our children will bring up things that maybe we feel uncomfortable with, things that maybe are taboo in our culture, but the positives are they're coming to us, right? They're asking for our support. So trying to keep that in mind, and really being there as an equal, as a thought partner. So when you're problem solving, I like to say to whether I'm working with a student or working with my own teens, it's, let's think through this, and I want them to feel like we're on an equal level of thinking things through. And also not judging, and not just not judging your own child, but also their friends. So if they share something with you about a friend, I think immediate response will be like, I knew it. I knew that person was no good. You cannot hang out with them. There's nothing, there's no more relationship there. So kind of taking a deep breath and saying, what, I don't need to judge this situation. I need to listen. So those are just some ideas when, talking to your teens, improving communication. There's a link in the chat on some ways to communicate with your teens as well. So in the spirit of communication, I'm going to go on to the next slide. I want to talk a little bit about some of the most important conversations that we have are also some of the most difficult, and but they need to be had. So I'm going to go through a list of 5, and as I'm going through them, there will be links in the chat for each of these. So feel free to click on the links. If you have information or questions, feel free to put that in the chat. I'm not monitoring the chat, but Charlene and Bev and Miriam are looking at the chat, and we'll be able to come back to it if we can't answer it immediately. So the first topic is suicide. It's uncomfortable. completely uncomfortable. Everybody's uncomfortable with this topic, rightfully so. But it is okay to ask your child, are you thinking of hurting yourself? Do you ever think about suicide? Do you know people who do think about suicide? Let's start using the word suicide. Let's use that word to destigmatize it. So we don't want our teens, our preteens, our kids to think they can't come to us, or we don't say that word in this house. So using the word destigmatizes the word. It's scary to hear your child say, yes, I think about that. But it's even scarier when your child has made an action to that end and you weren't expecting it. Just a couple of quick stats. I like to share these about this is on the CDC website. Suicide is the third leading cause of death in young people ages 15 to 24. A great reason why we talk about it. Boys are 4 times more likely to die from suicide than girls. Girls are more likely to try to take their life than boys. And guns are used in more than half of our youth suicides. So these are all important reasons why we want to have those uncomfortable conversations. So another uncomfortable conversation is sex, right? So we're always hopeful that, our young people wait, and they might not, or their friends might, or their friends might not. So the important piece here is to be relaxed and as open as possible. Talking about sex, talking about relationships, the prevention of HIV, STDs, and pregnancies, not always comfortable or easy, but you can encourage your teen or your child, your young child, to ask questions and be prepared to give honest and fair answers. So this will allow that door of communication. And, like I said earlier, it's never too early and it's never too late to start those conversations. There are books that are age appropriate for preteens as well as teenagers. So we have those on our website at the San Mateo Union High School District website, and you'll have access to that as well. But if you need more information, feel free to reach out. So along with sex, and a lot of people think that consent is only about sex, but it's not. Consent is about boundaries, right? It's about, this can be taught at any age and should be taught at an early age, that it's about letting your child know that they have a voice and that it matters and that they have choices. So they'll also learn how to respect the choices of others, right? And understand those concepts of consent and boundaries. So our next topic is substance abuse. Again, all of these things are the things that, we think about, we hope aren't happening. But the truth is they do happen, either to our own children or to their friends. So having these conversations is so important. And parents have a significant influence in their children's decisions to experiment with alcohol and drugs. And it really is better to talk before the child has been exposed to alcohol and or drugs. And when you don't talk about it, you're also sending a message, a very clear message to your kids. So, what do you do if you find out that your child is using, maybe they're vaping or their friends are vaping or using marijuana or alcohol, right? And how do you talk to your teens about that? The first thing I would do, and because we have such a robust TUPE program, the Tobacco Use Prevention Program, is come to one of our events Right now, we're partnering with the San Mateo Foster City School District, and we're putting on 4 different events over the next few months. And it is full of information. And I know that our therapists that work with our 2-pay program have a lot of information to share, and they want to share that with you. So knowing the facts, having information is very powerful when you do have those conversations. And finding a time when you know that you can be patient and be ready to listen and not just lecture. So when we first find that vape pen, or we hear that they've used whatever the case may be, is probably not the right time to just run into the bedroom and start the conversation, because it tends to be more of a monologue and not a dialogue when we're angry. And then also setting positive examples. That's, we got to practice what we preach. When we do talk to our children, finding the right moment. And I often laugh. I laugh when I say that, because I think about my own teens, and I'm sure everybody here is thinking, yeah, when is the right moment to approach a teenager or a preteen, right? And there might not be an exact right moment, but we definitely know when there are moments we probably should not approach them. So being mindful of that. And then also asking for support. So you're not in this alone. You don't have to do this alone. Just because you come to an event and you learn some facts doesn't mean that you have to sit in this alone. Use the people that can support you and support your child. So if that's a school or wellness counselor, if it's one of our programs, if it's a coach, if it's a mentor, whoever that is that can help support this messaging to our young people, that's what we're all here for. And then, remember that your teen is probably going to push back, but that's no reason for you to back off. You really need to just help them understand that you're involved because you love and you care about them, right? And you care about the choices that they make. And it's not necessarily because of a lack of trust. So, lastly, I want to talk a little bit about tragedy. There are so many tragedies that are happening right now, and our young people hear this information. They know there are national tragedies happening. They know there are hate crimes that are happening. There's personal tragedies, right? Family and friends that have been affected by COVID and all that implies. Maybe they've lost their home. Maybe parents have lost their jobs. Whatever the tragedies are, but not just personal, but also national tragedies and tragedies such as hate crimes. Those are all things to bring up in conversation and ask your child, what's going on for you? How do you feel about this? How does that affect you? How does that affect your friends? So it's okay to talk about those things. All right, we're going to move on. I know I'm going pretty quickly, so I apologize. So 6 stress busting strategies. So this is from the California Surgeon General's playbook. And this is going to be dropped into your link into your chat as well as a link. When you have some time, take a look. It's several pages, but it's really about supportive relationships, getting exercise daily, healthy sleep, nutrition, which is not about weight, but it's more about, proper nutrition to help combat stress, mindfulness, and just having space to be mindful that we need to engage in mental health care for ourselves and for our children. If we are not in a good place, it's hard for us to show up in a good place and in a good space. So taking some time to remember that these are the the 6 kind of stress busting strategies through Surgeons General. All right, so slide 7, and I want to be mindful of time because I can often go on and on because mental health is my passion, young people are my passion, and families are my additional passion. So there are 2 links here that Bev is going to drop into the chat. We won't have the time right now to watch them, but there are 2 links that I think you will all appreciate. And the first is about the pandemic, and it's from the Today Show and how it is impacting our youth and how we can help them. So a lot of what I've talked about, but again, just kind of reiterating that and maybe even some more information. And the second one is the teenage brain. And I love this video, and every chance I get to share it with parents and caregivers, I do. And it never gets old for me. Maybe because I have my own teens at home, it's that reminder that, you know, the frontal cortex is not fully developed, and the decisions and choices that they're making today will not be the same decisions and choices that they make in a few years from now. So when you have a chance to check those out, please feel free. And then the next slide is information on knowing your resources. So I have some information here on the community mental health resources. Now, this is only a few, but if you go on to our SMUHSD, SMUHSD website at the district, we have a plethora of community resources that you can connect with. We also have our San Mateo Union High School District resources here. So these are all resources that are available to you, and you'll have a copy of all of this that you can easily click to. And one in particular, because we're going to move over to Care Solace with Miriam and Tyler, is Care Solace. And this is a program that I can't do it justice to talk about, but what I will say is we purchased this service at the end of last school year for our students, for our parents, and for our staff members. We believe in this program. We believe in it so much that we just renewed our contract for 3 years. And we have had over 3,000 staff, students, and families reach out to this service. So this service is, and you can see this on the next slide, is Care Solace. And they support with, there's 2 links. There's the Care Solace link that'll be dropped into the chat, and also the San Mateo Union High School District Care Solace link so that you can easily access it. So with that, I'm going to stop because I know I've probably went over my 15 minutes, and and move this right into Miriam and Tyler. Thank you.
All right, Miriam and Tyler, take it away.
All right, thank you, everybody. Thank you so much for allowing us to get onto the agenda. My name is Tyler Chamness. I'm a client relations manager, and I'm here with my partner, Miriam, if you'd like to introduce yourself.
Yes, I'm Miriam Stevenson. I'm our Executive Director of Community Engagement, and I came over to Care Solace in September from Palo Alto Unified, where I did similar work as what April is doing for you all, supporting the community mental health and really focusing on youth mental health and how we can just raise healthier communities through education, through prevention, through identification. And our piece at Care Solace is through connection to ongoing community-based support. So I'm excited to be here with you all and spread the word, because we had found in our community that there was a missing layer of really wrapping around the adults in the system. So you all as families, our staff members and their families, as well as our students, because our students can only be as well as we are. Like April did such a great job of describing how we show up really creates the space for how our youth can be. So I'm going to let Tyler give you an overview of our system and how we connect people really quickly to quality mental health care and substance use treatment. And then we'll be available to field questions and just provide support to your community.
Right, thank you, Miriam. So I'm going to step through a quick slideshow to formally explain who Care Solace is, how we're supporting your community, and then we'll be able to field those questions. I do need to jump onto the San Mateo Commission on the Status of Women at 6:15, but I'll at least get this information across before then. So I'm going to share my screen and we will get started. All right, so Care Solace is a mental health care coordination service, currently partnered with over 250 school institutions across the United States, mostly K through 12, but some higher education as well. Right now, we're serving about 3 million students, but over 7 million people have access to the service because when we partner with an institution, the service is not only available to the students, but it's also available to their families. It's available to the staff and the staff families as well. So universal access throughout each district. The reason why we're doing this is because navigating the mental health care system on your own can be a little bit chaotic. And we're really on a social mission to break down the barriers of that system. These are some of the challenges that can get in the way of someone who needs help, getting the help that they deserve, whether it's just the social stigma of reaching out for help, long wait times, navigating insurance, language barriers. We've put a system in place to really hold your hand through this process, to break down those barriers and calm the chaos of the mental health care system. In California, we currently have over 85,000 vetted providers in our database. We do not have financial relationships with any of the providers, and that allows us to have an ethical and an unbiased matching process. We vet and match providers based on these categories here, but then availability is the primary driver. So once we have a short list of providers that meet the specific needs of the family we're attempting to help, we'll make sure they get the soonest available appointment. Just to understand what Care Solace is and what we are not, we do not diagnose, assess, or provide the treatment, but we connect the family with a licensed professional who can do so. And we do not do job coordination or help to find primary physicians or dentists. This is specifically for mental health care and substance use and everything that falls under those two realms. Most importantly, this is not meant to substitute or replace anyone or any relationship there at the district. This is meant to be a complementary resource to really wrap around the school-based support, pick up any loose ends or fill any gaps, but we want to take on the burden of care coordination and do that heavy lift on behalf of the staff and on behalf of the families. We're not a crisis response or crisis intervention team, so if someone is an immediate threat to themselves or others, please call 911 or the National Suicide Prevention Hotline. However, what we can do and what we've done successfully is coordinate aftercare. If someone does end up in the unfortunate situation of a hospitalization or a 5150, we can help set up an intensive outpatient program or an inpatient program for as soon as they are released. So there are two different ways that our service is currently being leveraged throughout the whole county, and one of which is a self-serving tool. Each district has their own proprietary link where you can anonymously and confidentially get matched up with providers that meet your specific needs. The other way that our service is being leveraged is through what we call a Care Loop dashboard, and that's where the school-based mental health staff can refer students and students' families directly to Care Solace, and then we reach out to those families to coordinate care for them. And through this dashboard, we keep the school-based staff in the loop along the way, giving them updates on the status so they can have the peace of mind to know that the families are getting taken care of. So our care team is a 24/7, 365 support service that really are experts at navigating the mental health care system and handholding families through the process. They each undergo over 100 hours of training prior to being put in contact with the families. And since we have implemented them, we've seen over 150% increase in enrollment in services from the traditional pathway of handing over a list of resources and hoping that the families follow up. But the care concierge actually call providers on behalf of the families. So they're the ones to wait on hold, to check availability, to navigate insurance, to make sure that providers specialize in the specific need of the family. Once we've done all that vetting, then we'll come back and say, hey, we found 2 or 3 providers that meet your specific criteria and they have availability here in the near future. At that point, if appropriate, we can do a joint call with the family to actually schedule and confirm the appointment with them. Or if they wish to reach out on their own, of course, that's okay. But we'll circle back. We'll make sure that they're happy with the options and we'll confirm that they were able to schedule and attend that appointment. Again, they are available 24/7, 365 via phone, email, and video chat. We've also partnered with a translation service that speaks over 250 languages. So language is definitely not a barrier for us. We don't want there to be any barriers. Miriam pulled pulled together a couple testimonials from San Mateo that we wanted to share. Both of these were from parents in the area. This one here said, "I really appreciate your attention and timely follow-up. In particular, I was very impressed with the priority you placed on locating someone as quickly as possible." This was another one that said, "I deal with a lot of customer service reps on a regular basis. I have never had as great of an experience as I've had with the care concierge helping me, Frank." So just a couple examples of some of the impacts that we've already been making and this partnership getting off to a really great start. Fortunately, we were able to partner up with Peninsula Health Care District, Sequoia Health Care District, and San Mateo County Office of Education to provide our service to all of the districts throughout the entire county. And we've been going through that onboarding process since the beginning of the year, but with partners like San Mateo Union High School District, who believed in us and gave us a shot early, we were able to partner up with them last year and just seen tremendous results already. That's everything we wanted to share from Care Solace today.
And Tyler, you did it in such a condensed time frame. I'm really impressed. We wanted to be available. I wanted to just highlight, we are here at Care Solace joining today so that you know about us before either you or someone you know might need help. We have provided a lot of support for people who are even in the system. They might be therapists themselves. And when they're in the role of trying to connect to care for a family member, for a loved one, even knowing the system, even having personal connections in the system, it doesn't make that process easier. And so we're here to support all. And like April's talk around saying things and normalizing things, one of the things we want to do is normalize the seeking of help. And before it is in a crisis, right? It's much easier to have interventions that are successful and not escalate if you seek that help as soon as someone's open to it. And really, we think about it that way. So we want to spread the word, and also we share those testimonials and experiences so you know as family members that you're not alone. Other people are going through the same thing. And we are committed to you having a companion for your journey as you're seeking care. So you're never alone in this. There are other people who are going through the same thing. And as April talked about, there's a lot of resources for you to tap into. And we hope that we are one of those to really have, so you have a companion through your whole journey. And you know that no matter where it ends up, that you'll have somebody right alongside who's advocating for what's best needed for you. I see that Tyler has jumped off. I'll join that meeting a little later, but I want to linger a bit so that we can address any questions, just participate in your discussion.
Thank you, Miriam. Thank you, Tyler. I think all of you who are online tonight and have listened to April and Miriam and Tyler, it's very apparent that we have a lot of resources in the community and at the schools for you. We've talked about some tough subjects today, and I just want you to know that we really are here for you, and the district and San Mateo County Office of Ed is committed to bringing in great resources like Care Solace that support programs like what April is running in San Mateo Union High School District. So again, we're a coordinated system. The Parent Education Series, my program, contracts with both Sequoia Health Care District and Peninsula Health Care District. So we're serving all of San Mateo County, trying to bring you information that you parents can use. April had mentioned Child Mind Institute, and I hope you will join us on Friday. They're actually coming. We have Dr. Dave Anderson, who's the National Schools Program Director, and the title is perfect for today. Put the oxygen mask on yourself, Parent Stress Management Techniques. So join us on Friday at noon. We'd love to hear from you. If anybody has questions, please feel free to drop them into the chat. Thank you, Bev, for all the links. There's lots of resources there tonight. And while you're thinking about what you might like to ask, we have a few minutes. So I'm going to get started with a couple of the questions that have come in earlier. Are we ready, everybody? Yes. All right. April, this one is for you. Our teens have really actually enjoyed remote learning, getting up late, setting their own schedules, etc. How will we ever get them back into a school routine?
Yeah, that's a great question. That's a great question. So, you know, starting small And that's one of the reasons we are going to open up schools, and all schools are opening up in a hybrid model, right? So it's slowly readjusting. They have been remote learning for an entire year, and everything that goes along with that, right? Not seeing their friends as much, lots of changes, and you start getting used to things after a year, right? It becomes the new norm. So we need to support small steps. So if that means coming to school twice a week on the hybrid model when we open, great. If it doesn't, what are some other things that you can do as a family, or that you used to do, or that they used to do, that maybe we can start back up, right? The exercising is important. Starting to get into that sleep routine that they had before, because it's really easy to roll right over and open up that computer and be there all day and not move much. So really kind of putting it on a calendar, I would say, of like what the day is going to look like and the things that you need to accomplish that day, and supporting them, not judging them, supporting, asking what you can do to help support them, you know, with getting back into a routine. And Miriam has she comes from the same background as I do. Is there anything that I left out, Miriam?
No, I think of myself too, and so I think normalizing for yourself, that adjusting. We've all been on this roller coaster of continuous adjustments, and while our brains are wired to deal with that, there is this taxation, this limitation. So I know April talked about stress over time, and one of those prolonged stressors that we're not necessarily honoring as much is the loss of our normality and the constant adaptation that's being required of us. And I think many people right now are feeling like they just kind of figured out this remote situation, and now we're being asked to adjust again. And so I think normalizing that helps keep us healthy in our minds, the fact that we don't get stagnant. And so how can we help our bodies and minds take these small steps, like April is talking about, to having routines that support yet another difference for us, and acknowledging that takes time, and you can't go from where we are to where you want to be overnight. And that shouldn't be the expectation. Schools open up, oh, you're just gonna, it really is slow layering on of small habits and small adjustments that set us up to have the energy and perseverance required to manage in-person learning different than what we're doing right now.
Thank you, Miriam and April. That's great advice. I think small steps, because again, there's some parts of this that have been good. And I think the kids would say the self-pacing and the being able to get up late and roll over and open the computer would definitely be high on that list. Mm-hmm. So here's a parent who says, my previously social teen has become quiet and passive since COVID. Will her personality return for in-person school?
Yeah. Miriam and I are like,
unclear.
I think there's a couple of things, and chime in anytime, Miriam, but teens are going through a lot. Even if we didn't have the pandemic, there might be ebbs and flows when they're a little more quiet, they're a little more social, or they're just kind of they're discovering themselves, and every day is a new day for them. So I can't necessarily say sure they're going to be back into that same space because they're evolving as young people. But they're, I think it really goes back to being mindful that their reality might seem different than our reality, but we need to listen. And maybe if we listen and we ask what they need from us, it could help support them getting to a better place, and being that thought partner with them, right? Like, let's think this through, let's talk it out. I'm just thinking out loud, what could work, and not coming in as the expert, or you really need to get outside, you really need to do this, because a surefire way to get a teen to not do something is to tell them what they need to do.
I think that's an excellent point. I think the only thing I would add on is kind of, so I'll use, I won't name my family member, but what I've discovered is some of this has given us permission to also accept parts of ourselves we may not have known were there before. So along that topic of April describing self-discovery and how they're trying things on and seeing what fits, what feels comfortable, I do think that for many people who might naturally be more introverted, that not having the pressure of being in person might change some of those aspects of our personality. So it's best to just explore that, name it. You know, I noticed this difference. What has that felt like for you? What has that meant to you? Or, you know, if they're not concerned about it, then maybe your concern isn't as significant. So really letting them take the lead, letting them define it, and monitoring it and checking in. How are you feeling? Do you want more connection? And just providing that support. So I think I would lead with just the conversation around, I've noticed this difference. Is there anything that you're worried about going back in person? You know, what has this meant to you? What has that felt to you?
I
So
think
not
that, oh, I'm sorry, go ahead, April.
I was just not saying, why are you doing
Right.
this? Why are you acting like this? Because they might not even know.
Oh.
But I like that, Miriam, just really, you know, hey, I've noticed this. How are you feeling? What's going on? And it might take you a couple of times. They might look at you the first time and say, nothing. I don't want to talk. Okay, that's fine. Might not be the right time, but it doesn't mean you give up.
And there might be an eye roll attached to that too, and not
Love eye
reacting,
rolls.
not reacting to that or the dismissal, and just saying, I'm, you know, just noticing and wanted just to check in. If it's something, let me know. You know, there are many people who are living kind of their best life in this realm, because socialization is looked different, and there are many people where this is very disconnecting, and a whole spectrum in between. And I think letting the person who's having the experience define what it means, and have that autonomy to define it, is really important.
So true. And I think about April's great advice that Dr. Ron McGann, who's offered previous parent cafes, would say, you know, talk to your kids, open up, say to them, you know, I really want to hear what you have to say, and just sit and listen. Sometimes, as April said, that's all they need. Or you can say, you know, I have a suggestion. Would you like to hear it? And then they may say yes, they may say no. Often they say yes. So here's a question that's related to what you've both been talking about. How can we keep the good parts of distance learning, independence, convenience, more family time, while getting rid of the bad parts, too much screen time, missing friends and activities?
I've been reflecting on this for myself as well, because I have noticed there are pieces separate from all of what's happening in the world and the trauma and the tragedy. There are pieces personally of, wow, if I didn't know that this commute I had, you know, these like healthy aspects, and the permission to say no to social engagements that felt obligatory. And so I think the first place is to start in reflection, either for yourself or as a family, and talk about what are the pieces that we have liked, that we have or have learned about ourselves, that we want to hold on to, we want to press save on, and we don't want to lose sight as our distraction gets pulled in or there's more stimulus or more social commitments, etc. And really just start that process of talking about, what have we learned? What do we like? What do we not want to let go of? Or what are the parts of it we are happy to be done with? Back-to-back Zooms, the fatigue, those components. I call it Zombie land. And really have that conversation, and then think about how you can start to craft and prioritize. How are we going to hold these pieces and put them first? You know, one of the things I've enjoyed is I have more time to have a family dinner and to see my family in space that, you know, that sometimes it's over Zoom, but the frequency has been really healthy. So how am I going to hold on to that? How am I going to prioritize that? How am I going to build things around that? My schedule, how am I going to schedule it so I hold it? And I think the first place really is to start with reflection, and then thinking about how to set your day up to hold on to those things.
That's great advice, Miriam, and probably a good family meeting topic. April, anything to add on that one?
I couldn't have said it better. And I really think that once you have that information, it's putting it on the calendar,
Yeah.
right? So you're accountable to have those family dinners, or if it's game night or whatever it is, so that you don't lose sight of what you find important.
What gets scheduled gets done.
Yep.
So true. So this is a question that I just think in general, April, you shared a lot about what parents should be looking out for. As kids head back into school, is there anything that parents should think about to see if their kids are struggling? Anything in particular that we should sort of see as a red flag?
Changes in behavior, like dramatic changes in behavior. If you start seeing maybe, like a dramatic change in defiance, or not coming home, or the friends change dramatically and it's a completely different friend group. If you suspect that maybe their coping strategies are not the healthiest and you want more information, it's okay to seek support. What would you add to that, Miriam?
I think a lot of the same things we normally look for, and so you've named pretty much all of them. I think I also pay attention to energy levels, and if those are out of sync with their normal times and it's lasting. So, you think, and it's hard because our calibration, our baseline is different being remote than it is in person. And so I would allow some time for them to set their new baseline and really think, does that energy level match what I would expect of them in the pre-COVID in-person time? And really just reconcile and look at those patterns and look if they're lasting. I do think that teenagers in general can be sometimes unstable and volatile, and so that up and down can be kind of their normal. But you try to get that range, and if it's outside of that range and if it's persistent, I also think that it's really good to talk with the people that see your child oftentimes more regularly than you do. And I, being a former school counselor and teacher and administrator, you see kids and if they're not quite themselves. And that's just another pair of eyes on your team to tap into. And it's not often that I think sometimes we have this idea of our relationship with school. No news is good news, grades, and that's it. And minimal ability to interact. And I encourage you to actually be that person soliciting this information to say, hey, I'm noticing some changes. I'm curious what you're seeing when you have them during the day. How is it there? And just broaden your perspective. And the same goes with your friends and family network, because you aren't alone, and really parenting is a community exercise, and you need all the people that you can engage in terms of getting different vantage points on your children.
And oftentimes if you have somebody like a school counselor, wellness counselor, or coach that has a different relationship with them, they might open up and share something that maybe they're not ready to share with you directly. And so that can help open that conversation. It's very important, like Miriam said, reach out. And your school, and I think if anything, this pandemic has shown that school is the hub for
Right.
many, many things. And, that's not going to go away. And we're here to support.
So well said. I drive by the schools in our community, and it's so sad. As you say, the schools are the heart of the community. Mm-hmm. And parenting, we are in this together. The tagline of our nonprofit, the Parent Venture, is actually because parenting is a growth opportunity. And Bev and I believe that with all our hearts. So thank you so much, April Torres and Miriam Stevenson, for your wisdom today and all of your magnificent resources. April, thank you. Parents, again, this will be available on our video library, and we'll be sending out again that list of resource links to you. I believe April will also be posting it on their website in the San Mateo Union High School District. So take care, everybody. Good evening. Have a great time heading back to school. Stay safe and stay well. Good night, everybody.